Okay, so we'll get started and then hopefully Tracy will be with us in time to do her presentation. So we are continuing on with a theme that we've had where we've been looking at the different strands of the National Autism Strategy, and we're looking at reasonable adjustments today. So I'm just seeing the thing about the beeps. We're trying to see if we can turn them off, but we don't know whether we can or not. If anybody's got any suggestions that they can take, should be happy to do that. Just letting you know that the session is recorded and you will have it sent out to you, but it will also be uploaded to YouTube so that people can look at it at a later date if you want to. Annette will send out an email to you when it's ready, and any other resources that we have or come to light during the day, Annette will send them out to you as well. So if you've got any questions, if you can put them into the chat, and there will be time to answer these as we go through the time that we have with you. Today we have got, sorry, just looking at this verse. Today we're doing reasonable adjustments. The last one in this series is on the 29th of November, when we'll be looking at health and inequalities, which will be quite an interesting subject matter, and I don't know how we're going to get through it all within one session, but we will do our best. So today, the agenda that we've got today, we have got a few films to show you today where we've met with some autistic adults, because alongside doing these webinars with our Hear Me, See Me, we also have voice groups where we meet quite regularly with different people across the region to get their input. And so we met with a few people and filmed them where they were talking about reasonable adjustments from their perspective. And so we've broken those down into little bite-sized pieces that we are going to interject through this session that we have with you. Dr. Amy Norrington, she's a consultant anaesthetist in the Northeast and wasn't able to be with us today live, so we did a recorded interview with her the other day. Tracy Brennan will be with us, hopefully live, when she joins us, and Annette will be looking out for her coming on. And then the rest is just looking at these films that we have and looking at some work that we've done with the Hear Me, See Me voice groups. So we are going to start off by showing you a small clip. And we met with Owen, Pat and Nicola. And just to give you a bit of a insight, Nicola is a lady that we meet with quite regularly who is autistic, and she also has got some mental health issues. And she is somebody who really finds it hard to be around people for quite a length of time. And so when we arranged to meet with her, I said to her, 20 minutes I know is your maximum. She was so wanting to share her experiences with you all, that she really put herself out, and she was with us for an hour, to her detriment. And I met up with her afterwards, and it had taken her a week to get over spending that hour with us. And also I checked in with her the same day once she got home. The trauma of having to relive some of the experiences that she's had is a trigger again for sharing, but she was willing to put herself through that to be able to share her experiences with you. And she has also sent me some experiences that if we don't have time to go through them today, I will be sending them on to you so that you can read them at your own leisure. It's one person's experience. And as you will see them as they're talking, Owen and Pat know Nicola very well. And they were so supportive of her through all of this. But I just wanted to raise that we put a lot of reasonable adjustments in on this day to help them deal with this, because it was a very new experience. Owen came back afterwards saying, absolutely fantastic, really love doing something different. But he was so nervous beforehand, and he was quite, I'd met him once before, and he was a lot more stressed this day of meeting them. But so they were willing to do it to share experiences with you. So we're going to see them, the first one where they're just starting to have a little chat together.
When I've been to the GP, they don't even know I'm autistic.
Yes.
I just assumed it would flag up, something like that, but they don't. So I've only just learned that whenever I've been to the GP or had a GP appointment, they don't know. They've got no idea.
Yeah.
And I've had a couple of appointments where at the end I sort of say, I just happen to mention autism, and they're like, "You're autistic?" You know, like they're sort of, they panic.
Yeah.
And I had that in the dentist as well. I had a dentist appointment, and at the end I just happened to mention autism, and they were like, "Whoa," you know, they had no idea. So that would be something that I think would be useful.
Yeah, definitely knowing if you're autistic, because it does have an effect, doesn't it?
Yeah.
How does it affect if they don't know?
Yeah.
How does that impact you when they don't know?
Well, it's because you might display some kind of behaviour that maybe they think is a little odd.
Yeah.
It would just help if,
Yeah.
you know, if it came up straight away, like, you've got autism.
Yeah. I think it'd also help the receptionists, because sometimes I think it's useful to have a double appointment. And if the receptionist knows you're autistic, they can then ask you if you need a double appointment.
Yeah.
So right from the beginning, that would be really useful.
Yeah, and I think as well, if the receptionist knew, and it's that preference of when you want the appointment, as in, do you want an appointment at a quieter time? And so that could be at the end of the day or the beginning of the day, and actually finding out, when that appointment is suited for you. And because, if they know straight away, and it's a bit, it's one of those things of booking an appointment when it's really busy is actually going to make it difficult for you, but at the same time, difficult for the doctor if you're going into the appointment. You're already stressed in the appointment. The actual appointment's not going to go very well. And so actually, if straight away the receptionist knew, and that it was on there that actually, this patient needs to have an appointment at a quieter time. And
Yeah, definitely. And for me, having been able to have the same doctor as well, I can't stand having to talk about my issues to a different doctor every time.
Yeah.
So if that was on there, that was autistic, it would really help.
Because we get tired having to explain, don't we? If we have to do it
Over
again
and
and
over
again,
yeah.
we can't get. Well, I've had situations where I've just gone mute,
Yeah.
and then they think there's nothing wrong, or they think
or you're being difficult,
Yeah.
awkward. It's just like, because I went to a nurse recently, and couldn't sit down because I was so anxious. But he got like, "Why aren't you sitting?" And I'm like, but he probably didn't know I was autistic, so.
So I would just like to sort of raise an issue with that, where Nicola just said they might not have noticed I was autistic. Nicola is a good example of somebody who masks her autism really, really well, and often to her own detriment, that people do not realise the needs that she has because she is covering them so well, trying to appear as neurotypical as she can and trying to fit in. And she has got so much to say. She is so eloquent. She has got so many strengths. And unfortunately for her, she has a lot of trouble sort of being around people and being able to communicate all that she wants to. So it was absolutely great here, sort of having a part of this. We'll be going through the questions just a bit later with anything that you want to say around these short pieces of film that we're going to do. We'll do that near the end. But now we're going to go on to listen to Dr. Amy Norrington. So the reason I asked her to do a presentation today is that the James Cook Hospital were awarded a gold award from the North East Autism Society for the work that they'd done. It's in their children's services around access and all the reasonable adjustments that they were putting into place. And although it's been done in the paediatric service, they are still the same sort of things that you would be looking at when you are looking at adult services. So although she is talking about things that they are put into place for children coming into hospital. It's really sort of thinking around where you are working. Is there anything that we can do, and looking outside the box? And she does go on to say that they are now looking at the adult work that they do as well, and through the adult teams, and how the good practice that they now have there is being spread through some of the other teams. So I will start this one for Amy, and I will take my picture off the screen while you're watching this. Right, so just like to welcome Dr. Amy Norrington from the James Cook Hospital in the Northeast, who's going to talk about work they've been doing to look at reasonable adjustments. It is about children, but anything that you're doing for children, you are also doing for adults as well. So I'm going to pass over to Amy, and welcome, Amy.
Thank you very much, and thank you very, very much for inviting me to talk today. My name is Amy Norrington, and I'm a consultant children's anaesthetist, as you kindly said, at the James Cook University Hospital in Middlesbrough. I also lead our paediatric pre-assessment service, which in layman's terms is the service that prepares children and young people for coming for operations at the hospital. Now, we know that autistic patients face healthcare challenges in every aspect of healthcare, but coming in for surgery does present a particular challenge. And what we do at South Tees is we use our paediatric pre-assessment service to individualise care of those children and young people. And what I'm going to talk about today is the challenges that autistic patients face, and then move on to talk about what we've done to overcome some of those challenges. We know that autistic people face huge health inequalities, and it's terrifying to note that they have a reduced life expectancy over every diagnostic category. You only have to look in the press to see that healthcare often gets it wrong. Oliver McGowan's case is the prime example, and it's through that amazing work by his mother that we now have legal requirements to put training in place so that staff understand learning disabilities and how to help autistic people with the challenges they face in healthcare. Also to note, which many of you may not know about, is that the Association of Paediatric Anaesthetists of Great Britain and Northern Ireland produced a best practice guideline in July 2022. Now, this guideline is largely based around the provision of pre-assessment services, because believe it or not, if you were 18 years and 1 month old, you would have a full pre-assessment, see a nurse, have medical checks done, heights, weights, blood pressures, and have the experience of surgery explained to you. But it's not standard practice to do the same for children. Some centres like mine have been doing it since 2005, but many haven't. And so this document addressed that disparity between adults and children. What's interesting in that document is that it has a specific section for helping children with the management of anxiety coming up to theatre. And what is interesting as well is it talks about the fact that pre-assessment services should develop links with local providers and charities who work with children with anxiety, autism or other specialist needs. And it also talks about development of pathways for autistic children. So the CQC are saying that we need to start looking at improving the services we offer around surgery to children who are autistic. The APA, governing body for children's anaesthesia, are also saying the same thing. And there's a move across the country now to start developing these kind of new approaches. We know that there are 5 main barriers for autistic children coming in: communication, difficulty explaining things to medical staff, the challenge of booking appointments around their routines, of having to ring up, of having to have a virtual consultation sometimes, not being able to see people. The sensory challenges. Hospitals are sensory explosions. They have noise, light, smells, music, unexpected touch comes towards them. There are crowds of people. It's uncertain. You don't know whether your 10 o'clock appointment will be at 10 o'clock, which means you can't plan your routines. And understanding what is going to happen as well can be a challenge. This all leads to challenging behaviours, which can have variable reactions from healthcare staff, and also negative experiences that they may have had of healthcare previously or interact, creating a greater barrier to healthcare. So we're just going to have a brief look at an operation. For those of you who are familiar with anaesthesia and surgery, this is the pathway that most people pass through. You come in from home to the hospital, you go to a ward, you pop into a bed, you get put in a gown, maybe some cream on your hands, name bands on your wrists. quite a few people come and see you, and then you pop off for your general anaesthetic and have a little snooze. You get your operation done, and when you wake up, you go to a recovery ward. You then go to a ward, and when you're ready and you've eaten and drunk, you head off home. It's a fairly simple pathway, but actually there are huge challenges at every aspect or every part of this. Simply getting from home to the hospital for an autistic child or young person can be a huge challenge. You're changing their routine, you're stopping the meeting. They don't quite know what's going to happen. They normally get the bus to school, and now they're getting a red car to the hospital, and it's not their usual car. They're not really sure what's going on. And they may just refuse before they even get to the hospital. Walking in the hospital, busy, noisy, changes of smell and colour, bright lights, getting to the ward, same kind of things, and then being told you need to sit in that bed or that chair. You can't move around. And for some people, it may be that movement or that stimming activity is the way that they can regulate themselves. You might have to put a gown or wristbands on. You might have to have observations done, which means tight things around your arm or funny beeping noises. You might be given medicine that tastes a bit strange, and all of those not only challenge you from a communication and sensory perspective, but limit your coping strategies. And again, you could get a straight refusal even before you got to your anaesthetic. The anaesthetic room itself is a real challenge, and all anaesthetists know that. You've got a different environment, different people. There's that needle. The needle is the elephant in the room that is a real challenge, or the mask that makes you feel claustrophobic. You've got different smells. You can hear the drill from another theatre down the corridor. Everything is different. And when you wake up, you feel confused and you don't know where you are, with more changes in smells and stuff. And then you have to eat before you can go home, but that food is on the wrong plate or is the wrong type of food. So all of these provide huge challenges, which we as healthcare professionals really need to address. So how have we made changes? Well, we use our pre-assessment service to deliver a care pathway to improve the care of children and young people coming through. We identify them early, and we have got really good engagement from our surgeons. Our surgeons don't want to cancel patients on the day of surgery. It costs around about £1,000 an hour for an unexpected cancellation on the day of surgery. It disrupts their operating lists, increases waiting lists. It actually reduces the safety as well, because the more change you put into a list once it's been established, the more likelihood it is something might go wrong for another child later down the list. So our surgeons are very keen to engage with us because they don't want to cancel patients on the day of surgery. And often we identify and have patients referred to us well in advance of their operation. We listen. Healthcare professionals do not have all the answers, and working with families as a team, and our tagline for our service is taking the journey together. This is something we do together. We then work with them to create an individual plan for their admission, and we prepare them. We help them understand what might happen, and then we work on adapting our environments to their needs, and underlying all of that is a lot of staff training. So breaking that down a little bit, as you can see on the screen here is our autism passport. Now I know that most children and young people have a fairly hefty autism passport, which they may bring into hospital with them. But if I'm very honest, the staff don't always have a chance to read of that. So we tackled that barrier in pre-assessment, and after identification, either by the surgeons or by the nurses, because every child, regardless of whether they have any medical problems or anything else going on, has a pre-assessment. So every child gets that half an hour to 45 minutes to spend time with a nurse going through medical history beforehand. And we'll either identify their autism at that stage or by prior referral. We then listen to them and we fill in this passport. It has a little bit, as you can see on the far hand side, about medical problems. It then talks really in more detail about communication, likes and dislikes, and how they feel about light, noise, touch, smell, sounds and taste, because actually we know what the usual pathway is, and once we understand about their needs, we can start working out where the trigger points in that pathway might be. We also look at the really simple changes we can make. Where would they like to have a hospital bed? In a main bay, or would they like to be in a quiet area? Will they have the anaesthetic cream on their hands, or is that just too much from a sensory perspective? Will they take liquids or tablets? How would they like to go to sleep? Now, their preference there is not always possible because we have to keep them safe, and there are some things we can't change, but we can adapt the how, the where and the when to their needs. And then we look at other aspects like, do they want to have a pre-medication medicine, and what they like to wear in the hospital. And they're simple changes that really don't affect the speed or the efficiency of any pathway by making. We then look at their environment, we look at what they want to wear. Admission timing is very important. I have found that a lot of surgeons will just say, this child's autistic, they're going first on the list. Well, that's wonderful if that child doesn't like uncertainty of waiting, but if that child needs to have 3 showers and do certain things in the morning before they come in, they're better off coming in at 11 o'clock. By allowing that morning routine to proceed and bringing them in when that's completed, their anxiety will be reduced. What people often don't realise is the more anxious you are, the more anaesthetic you need. If you need more anaesthetic drugs, you are then likely to have more pain and be more sick and have a slower discharge afterwards. So if we can minimise the anxiety in advance, we actually improve the outcome afterwards. We then put everything together to create a plan, and you can see my theatre journey document on the far side. If a child has very straightforward changes that need to be made, that's just made through the autism passport by the nursing staff. If their needs are more complex, then they come and see a consultant anaesthetist in advance, and we work through the theatre journey plan. And we talk about pre-medications, sedatives, which ones might be best, because actually how you actually get those sedatives in can be a challenge. So another child that I have seen, we actually delayed his surgery by 3 weeks, and we sent him home, and his mum bought 3 or 4 different types of vitamin tablets, and over a 3-week period she gave him a different vitamin tablet every day, with his usual couple of tablets that he took. So the colour changed. Now he saw them as vitamin tablets. There was a lot of work she had to do to get him to swallow them in the first place, but she managed to do that. And then on the day of surgery, we simply substituted the vitamin tablet for a sedative, and he took it without a problem. So the work was done beforehand to make the on the day easier. And then we look at plans for the anaesthetic, recovery and discharge. We have some resources which we provide to families. The app you can see on the right-hand side of my screen is the Little Journey app. Now, Little Journey is a programme that a lot of hospitals in the UK have invested in. It has the theatre pathway, which the children can access from home on their tablets, and it's either communicated through a VR headset or as a 360 photograph on an iPad that they can move around to explore the room. It creates familiarity in not only the structure of what's going to happen broadly, but also the rooms they're going to come to, and they can look at it as much as they like at home. We also offer visits to the theatres. We offer relationship building with our healthcare assistants. So if you meet a healthcare assistant, they will hopefully, if we can possibly organise it, be the healthcare assistant that you meet on the day of surgery. And we also have the sequencing cards you can see there that we send out to parents in advance. If we can help the parents as well and reduce their anxiety, their children are less anxious. We've done a lot of work working with the North East Autism Society to develop our environment. Our unit now has 3 zones. We have the zone you can see at the top there with the nurses. That's our brightly coloured, well-decorated zone with 4 beds for children. We then have a play area, and on the other side of the play area, which has an interactive floor and lots of sensory toys, we have the blue area. The blue area has 2 beds. It is plain walled. It has dimmable lights. Those ceiling lights that look like space can be on or off. It has a separate toilet to the main unit. And the idea of that space, which was actually designed by a group of autistic teenagers, is that it's very calm. It just has a TV and plain walls. It's quieter than the rest of the unit. And the pink room is our sensory room, which is just off the side of the blue area. That can actually be any colour you like. It can be white or it can be Blackpool illuminations. It has sensory light boxes, white noise machines, a padded floor, and it's very quiet when the door's closed. And what this allows us to do is in advance plan with the child and their family how the environment will be best created for them and create a calming environment. Because as I've said before, if you can get the anxiety down beforehand, then the child is easier to anaesthetise. We have worked heavily with the North East Autism Society. We have put in place awareness training for all of our theatre staff, and then 26 of them want to do autism champion training to further develop their knowledge and understanding of how to help autistic children and young people when they come to theatre. That's a partnership we're continuing, and we're now rolling out 2nd phase of training, or trying to, in order to keep that training process going. And what we're doing now is we're taking this work that we've done with children and young people and we're moving it across to create our additional needs pathways for adults, which is being led by our matron, Kim Clements. So did this work? This is a slow process. It's an expensive process in terms of time, but did it work? So we looked at children and young people referred to this particular pathway from April to March last year, and they were identified either at pre-assessment when they saw the nurse or by surgical referral. They saw our nurses, we did the autism passports or the individual plans, or they saw me in clinic. And this is our results. 100% of parents felt this was useful. And we asked the parents to score their anxiety about bringing their child in to have their procedure done. And of the 27 that we had back, before pre-assessment is the blue bars. And what you can see is most parents were scoring anxiety scores of 5 out of 10 to 10 out of 10. And after they'd been through the process, most anxiety scores were 1 out of 10 to 5 out of 10. So we reduced that parental anxiety. And what we know from scientific studies, mainly coming out of America with a gentleman called Kane, is that if you can bring parental anxiety down, you bring the anxiety of the child down as well. So in conclusion, what we've shown is that using these paediatric perioperative medicine clinics, we can individualise the care of autistic children and young people. The early identification is the most important thing, but then it's the planning and it's the making those simple changes to make it easier for them. Fundamental to everything is that we listen to the child and the family and we discuss the options and we're open to modification pathways. Just because we've always done it in a certain way doesn't mean we need to keep doing it in that way. And we've really engaged with our experienced local providers and charities who have so much to offer us. And in return, we can help them with processes they may need to help children in their care. And this is the words of, at the bottom here, of an autistic young lady who wrote a wonderful book called Rose. And she said to try and see the world a little differently. And if you take nothing else away from my presentation today, just think about trying to see the world a little differently. Thank you very much.
So, Amy, can I just ask, what was the effect on the staff after they've gone through this process and you've explained to them what they're going to do, how it's going to change? Have they found a benefit in being able to do this?
We've had incredibly positive feedback from all of our staff. So first of all, the training process, the staff really enjoyed. The working with the North East Autism Society, Kerry's training package got really positive feedback from everyone, and particularly our champion training. That was very, very popular, and we've had lots of requests of people who didn't do it last time who want to do it. They can see the value. At the end of the day, staff want to give good care to their patients and they can see the benefits of this. They can see the reduction in cancellations on the day of surgery and they can see the improvement in experience. What you have to remember with children is if you get it wrong with a child, you're going to affect the rest of their life. We know that children who have bad experiences in hospital then consult later when they're adults. So you get cancers presenting later because they're scared of needles or they're scared of hospitals. So it's really important the staff get it right. And the staff love the fact that they are able to get it right. And they love the fact that they can see themselves making a difference to children and young people.
Yeah, no, it's great. And have you seen that because of what you've been doing, they're now understanding what reasonable adjustments are and able to then spread that over other work that they're doing, that it becomes more second nature?
Absolutely. So about 10 years ago when I started doing this, every single autistic child would come through my clinic and I would write the same plan, same starting part of the plan for pretty much all of them, no wristbands, no cream. And the nursing staff were a bit reluctant, first of all, and now I don't actually see a lot of these children. Most of them just pass through my nurse-led clinic. The only ones I see are the ones where we need to throw the whole rule book out the bag and do something completely different. But most of the children now are seen by the nursing staff who manage their care with the healthcare assistants, and it becomes second nature. You don't have to ask them not to do something. They'll look at the child and say, well, I've had a chat with them and actually they'd rather not have that, so I'm not going to do it. So they're now empowered. So yeah, it's become part of our organisational matrix now. And what's great is that our adult staff because of the training that we put in for the whole theatre team, and we're a mixed theatre suite, so we have adults and children in the same theatre suite, because of the work we've done with children and the training we've done for everybody, that's why we're now filtering this service into the adult system, and we now have additional needs referral pathway for adults, and we've just managed to secure last week a side room on one of our wards, which is going to be adapted with some sensory equipment for those adults, led by our matron Kim Clements.
Yeah, that's brilliant. Well, I'd just like to thank you for your time, and just to say to everybody that Amy is very kindly given some of her day off to do this for us. So thank you so much, and I hope you enjoy the rest of your day without having to do any more recording.
Thank you very much. If anyone has any questions, then if you email Heather, then she can forward those on to me, and I'll do my best to help anyone who needs some help.
Thank you. We read that the other day, and if you have any questions for Amy, if you can email Annette, who was sent out the invitation for today, then we will forward the emails on to her. I wasn't able to click on my screen while she was talking, otherwise it stopped it, so I couldn't see all the chats that were coming through. But were there any questions that we could answer today that came up? Annette, did you see any? I did see something at the start where somebody mentioned that Amy had said somebody with autism, and I'd just like to just have a little chat about the language that's used. Amy was very open with me, saying that she is constantly being reprimanded by her contact at the North East Autism Society of getting her to change some of the language that is used. At Autism Bedfordshire, we would always say autistic rather than with autism. And one way of thinking about it is that we were told by an autistic chap that if somebody has autism, is with autism, it sounds like it's in a bag that he's got on his back and he carries it around, that I have my autism with me. But actually, if you are autistic, it is part and parcel of you, just like your sexuality, your personality and everything. And you cannot take it off and dump it. It is part and parcel. So we would always say autistic. But when you were talking to an autistic person, it's what language they prefer to be used about them. So please do check on that. So, Annette, did you see the questions that came up that we could answer now?
There is one that asks, where did the funding for this work come from?
So that would be a question for Amy, but I know when we were talking, she was saying if somebody misses an appointment, is it something like £1,000? I'm sure some of you out there will know this better than me. But the cost for missing an appointment is huge. And although it costs a lot to put something like this into place, actually from a money cost value, it's actually saving a lot of money down the line by putting all the preparation in first. Right, so this is our group back again, where they're all talking about different
When
reasonable
you're sort of
adjustments.
saying about like reasonable adjustment, one reasonable adjustment for one person is going to be completely different for somebody else. So you shouldn't make that expectation of, so yesterday you spoke to somebody who's autistic and they say their reasonable adjustment is they don't want any sound in their appointment. So the fact that they want clocks taken out of the room because they hate the ticking noise and that they don't want any light or anything like that. But then the next person that comes in, they could be really sensory seeking. So actually, noise and things like that don't really bother them that much. And that, but actually they may need that light in that room, and that having no light is actually, they can't, they need that light in that room. But because you've automatically thought, well, that person's autistic, and at the same time they may need to walk around, they may need to move around, and it's sort of talking to that person, what actually, what can we make your appointment easier?
Pat was talking about her special interests or things that you're interested in. Does that help relax you?
Well, I guess if they were to sort of talk about things that I'm interested
Yeah.
in,
So your guitars.
I might not shut up then.
Yeah.
You know. So maybe not.
Because when I'm really stressed, if someone talks about their day, just what they've been doing and things like that, that also helps me calm me down. But I have to then explain that to somebody. Look, you know, I did that when I was having my cast taken off, and they were just like, "What are you talking about?" They just treated me as if I was this weird person. But then I got stressed, and then they started just talking about their day, and then I was perfect. You know, I got a lot calmer. You
Yeah.
know,
I think with
so
me, it's small talk. You know, I've had doctors,
yeah,
dentists, especially the dentist, try to put you at your ease
yeah,
with small talk, because that's what works, I suppose, with most other people.
yeah,
And then when I just sort of nod or go, huh, like that, and then you feel even worse because you
worse,
think, oh, they
yeah,
must think I'm so rude.
yeah, yeah,
You know, I can't even talk about
yeah,
the weather.
yeah. Oh, see, I'm very good at talking about the weather. It's one of my top special topics. But that just shows how different, you
Yeah.
know, we are.
Yeah.
It's not because, you know, you have a very specific interest. Whereas, yes, I've learned to talk about the weather, but that's because for reasons the weather is interesting for me. But yeah, but I think you said earlier when they go, "How are you?" And I go like, "I'm fine," and then I'm going like, "But I wouldn't be here if I'm fine, would I?"
It's a learned response, isn't it?
Yeah,
It's
you're
one of
just like,
those,
"Please don't ask me how I am,"
please don't ask
because
me how.
I'm come to the doctors. That means I'm not fine,
Yeah.
or even yeah.
Right, Tracy, how are you doing?
Hey,
All
I'm all
right.
right. I'm sorry I was late, and it's probably slightly disorganized of me, but thank
That's
you.
fine. So
All right.
I'm going to hand you all over to Tracy. Do you want to share your screen, Tracy?
Yeah,
Have you got
sorry, I'm
something?
just going to close
Just
the
stop sharing mine.
Okay, let's see. My technology still, after all these years of following COVID, is still not that great.
So I would just say to you, Tracy, one of the films that I showed earlier with these three people talking, they were talking about when they got the GP and how they wished that the GP knew that they were autistic, that there was something on their system. And I haven't actually mentioned what you're going to be talking about, which is this digital flagging. So yeah, over to you.
Thank you. Yeah, so I'm Tracy Brennan. I'm the Senior Manager for Leader, Learning from Lives and Deaths, people with a learning disability and autistic people. Can I just check, Heather, can you see my screen?
I can, yes.
Yeah, okay. I'm responsible with working with all the integrated care boards and systems to look at learning disability and autism health inequalities, and to consider how we can improve situations, and that's based on what is the long-term plan nationally, and we have some indicators and work streams that are going on and taking place throughout the country. And the piece of work I was just going to mention today was around the digital flag. So we've been talking about the need for a digital flag for a very long time. They are now in a position that a digital flag underlines IT systems. This is to enable reasonable adjustments to be identified, or recorded, not so much identified. So the aim of the reasonable adjustment digital flag, as far as the programme is concerned, is under the Equalities Act, organisations have a legal duty. And I think that is a real important point to make, that this isn't just a nice to have, that there will be a lot of requirements, not just for health, but for social care, and how we work with our other tertiary and our voluntary sector to ensure people know that someone requires a reasonable adjustment within their life. So the digital flag is currently has been developed now, is in the process of being tested across the country in various formats according to different systems, IT systems, and hopefully it will be available to be seen in the early part of next year. In the meantime, there is the process of an information standards notice that's going to go out to a lot of providers, so trusts, integrated care boards, like all the different services, social care, that will tell people about the fact that the digital flag's come in, and that it will be a mandated need. And I suppose what's also helpful to think about is that the reasonable adjustment flag hasn't been developed, although the program's been around the learning disability and autism program, it isn't developed specifically for that group. And I always kind of are of the opinion, if we can get it right for people with a learning disability and autistic people, then actually on a much wider community base, more people will have better services. And the digital flag eventually will be something that we would expect anybody who meets the Equalities Act, so has who has a disability or long-term condition, to be able to have recorded. It is something that the person has to consent to having recorded, but so it is going to take some time to be able to see the increase happen. But initially, we're just working with learning disability and autistic people. So we're beginning to hit the ground running with this. Now, the importance of the digital flag is that really what we'll be identifying is that where one system, IT system, has the notes of an individual, that information about reasonable adjustments will hopefully in the future be able to be seen by a number of services. So we would hope that the flag could be seen on a hospital register because it would have been identified through the GP register. So the intention is that you won't have to repeat yourself once a reasonable adjustment has been identified and recorded, and then people will have hopefully better services. So just moving on, this was because I kind of was a bit, I missed it being today. I have just used a presentation I took to a nurses forum, but so I don't want to teach people to suck eggs, but really what we're really needing to do is these 6 steps. So as and I missed who's on the call today, but I think it applies to everybody. One of the things that's really important, I'm sure Heather's gone through a lot of the pieces of work around how to the importance of reasonable adjustments, but how people can identify what reasonable adjustments are needed. And I think that's what we'd be asking is for people to now identify what reasonable adjustments are needed. And I have put, it's not a want, so it's not a nice to do, but it is that thing, that change that has to happen to make services equitable for the person. The recording is done through the GP practice. The GPs have something called SNOMED codes. And basically anything you do when you go to your GP practice, they would have a code for all sorts of things. One of the codes that they have is on reasonable adjustments. So within that, there's subcodes. And there's a huge number that would mean you'd be able to relate the needs of the reasonable adjustments to have it recorded on the GP system. As I say, at the moment, we're still in the testing process, but that information would then hopefully, as the system becomes more intuitive, be able to then transfer that information into other records. This will mean that it can be seen. I've put where you work, but it will be, I'm talking more about if you're a person or an autistic person, that you'd be able to know that information is there. But as a practitioner or a provider, that should come up on records. And you would be able to then share the information and it would be shared. As I say, the consent's the really important bit because obviously we are sharing information. The importance then is knowing how to then deliver that reasonable adjustment. So meeting the needs of the person in also ensuring that reasonable adjustment has been made. There is some training that's being developed, and that will complement some of the Oliver McGowan training. And it will be the Oliver McGowan followed by, hang on one moment, sorry. The Oliver McGowan training would be an additional module to the Oliver McGowan training, and we'll be able to support clinicians and practitioners and services to know how to make a reasonable adjustment. And that will be ready hopefully in the early stages of next year as well, when we're much more ready to roll this out in a bigger way. And the other part is about reviewing those reasonable adjustments. So as time goes on, some people's needs change, and that has to be something that's taken into account along the way. So they're the key areas that I think is really important we start thinking about. Just to kind of illustrate how it will work, there's going to be something, and I am not technical, but there's something called an API, which is a piece of technology that fits on everybody's different systems, and it brings information together. And I'm not going to go into that much information, but to have your information put on there, consent is really important, and it's about then using those 6 steps to ensure care is the reasonable adjustments are there. But hopefully what the intention is that where the reasonable adjustment flag has been added, mainly centrally from the GP, that or from by being through another record system, which I'm not going to explain too much because we're hoping to avoid using the record system, that the other services will be able to link in. So it is about the interoperability. The notice will be available soon, and it's designed so that organisations have a process to develop a process in place to be able to ensure that digital flag will be available and added. I think this is more about for processes for ICBs and where we're going to be, and social care, about how we take this forward. But it is really important that the standard is acknowledged by providers. So really, I mean, that was the key messages. I suppose to take it forward, what we'd be asking anybody with an autistic person is if they first think about what reasonable adjustments are needed in their lives, and I think there's some training and support that's needed around that, which I'm sure Autism Bedfordshire have been working with people to support people to consider what is needed for a person, and for them to take that information to their GP if they ever had an appointment, to ask that's recorded on their records. The IT bit will be something that other people will be doing, so it would connect up separately. Another part is about staff knowing that the reasonable adjustment recording processes are available, but also knowing how to then make those adjustments. So I suppose from the angle of discussion around the digital flag, this should be a really good way of picking up when the needs of a person when the needs of the person can be identified in a more consistent way without having to repeat people's stories, which I know can also be very frustrating. I've taken down the slide because I think it was actually, I don't know if it was blipping over, but I'm sorry, Heather, did you say that I only had a certain amount of time left or something? I couldn't hear you mentioned something.
Yeah. No, I just kept freezing, I think.
Oh, okay. So ultimately, I suppose I really just wanted to let you know this is coming on board, where people are coming to practices, or that they are coming to contact with GPs, that GPs need to be reminded that there are reasonable adjustment flags. Obviously, in the longer term, we're talking 22% of the whole population who would potentially need a flag. So, this is something that economies of scale and encouraging that process to start happening is really important. And in the meantime, whilst the interoperability isn't happening between IT systems, that I suppose the ask from myself or working with systems is that any planned care, it's not so good if it's an emergency care because you're not going to be able to see it so much, but any planned care where anyone is required to go to an appointment, that and a GP is referring people, that we ask that in that referral that those reasonable adjustments are stated in the referral based on the codes. So based on the information. Now, I know Heather's got the codes. It's absolutely massive number of codes, but I think from the very beginning, if we can just start with making sure that it's noted on there, that a reasonable adjustment's needed, and then people can start asking the right questions, then that will be a step forward. But ultimately, I think there's still a lot of work to do, but it's now, I feel much more confident that we're moving forward with it, and that very soon people will now have the space to be able to say, have you checked my records? There's a flag attached to it. Is that
Thanks,
okay?
Tracy.
There's
There's loads of questions come up, so can I just pass them
I
to
don't
you?
think I'll be able to answer them all. I can see how many people are here now. So,
See. So will the digital flag be on local authority social care recording systems too, or just the NHS systems?
no, the intention is it will be on local authorities. I think one of the pilots in the country is about a connection between a local authority system that's being piloted with. In our region, we have piloted, we haven't done the interoperability IT part of the, we're not doing that part of the testing. We were doing some testing around people's voice and also about training in and that was Hertfordshire that took that bit on, but local authorities will also form part of that mandated notice.
Okay, and then somebody says that if the person who said this, if I've got this wrong, please put another message on to get me right. But if digital flag you are autistic, you will not get help for anxiety, etc. So would it pick up on anxiety and as part of autism, and is a recording in for that?
So the way I see the flag isn't about the condition itself. You don't even have to know what the condition is really. It's about what you need. And I'm pretty sure if you can say what I can, honestly, there's loads and loads of codes. Heather will absolutely invalidate what I'm saying about the number of codes. But if someone had anxiety, it wouldn't be the anxiety you'd be wanting to look at. It's what would you need to happen that would make the services easier. So maybe it's a longer appointment, maybe it's a pre-call, or what would stop the anxiety from having. So that's the bit people need to start thinking about, is what is needed. So we can say someone, an autistic person will experience anxiety, but that obviously, as we heard just before on the video, isn't the same for everybody. But within that, what needs to happen as a reasonable adjustment that would make things easier to access those services? So I would very much be thinking about the fact it's about the need for support for change as opposed to the condition itself. And you know, we've talked about, for those that work with learning disabilities, we have a learning disability register, but within that information it doesn't actually specify what kind of learning disability you have or what level of need you have and what reasonable adjustments are needed. It's just know that we've got a register and we know who's got a learning disability. So it's not particularly helpful with reasonable adjustments because you can't say everybody's the same. By doing a reasonable adjustment flag and at least recording reasonable adjustments on GP notes, within that we'll be looking at the support that's needed.
Thank you. So then we've got, I'm working in mental health. There is a massive gap in the understanding of neurodivergence and or autism. The flag is fab, but if people don't have an understanding on a base level, there may be things missed. And I'm guessing some of that is we need to get training. The words out to the patients as well, that they actually raise it. But obviously we all know about the training definitely needed, and especially I think in mental health.
Yeah, and I think that's why having additional add-on to the Oliver McGowan mandatory training would be really helpful, because it's Oliver McGowan mandatory training does include reasonable adjustments as a key point, but really that doesn't go into the thoughts of how do you make a reasonable adjustment, what kind of reasonable adjustments would you want to think about, and then how can we make sure that that the individual knows what they're looking for, because I think you only know what you know, don't you? You kind of build up a knowledge base. You've got to then know what you're able to have, rather than just what your experiences are now. And I think for people, autistic people, but and people with a learning disability as well, people aren't necessarily going to be aware of what they can have because they've never been given that opportunity. So there's some work around that of, what if you were in a hospital situation. And I remember from a very, very early on presentation that was given by Autism Bedfordshire, we had an autistic lady who talked quite in depth about a situation within their hospital that they had due to an emergency, and all sorts of feelings she had. And I suppose it's going to be something about unwrapping those feelings. And well, if the lights caused her distress, how would we get that point across in the reasonable adjustment coding to make sure that lights need to be off, like, when they're in a room? So there's kind of there is going to be some additional training for staff, but I think there's also some work to support the individual's voice.
Yeah, thank you. Might be very useful to have on the police national database with persons' consent if able to give it. Are the police included or not?
Yeah, it's a shame because we're doing some work with Bedfordshire at the moment, and we're working quite closely with the Health and Justice team. I know, Heather, you've been involved, and their IT systems probably don't connect. But if someone was to require reasonable adjustments who might have been needing to, I don't know, have be taken into the police station or then they always would have, I'm presuming, without taking anyone's subjects, I'm presuming that they would have a medical check first, and they would probably be able to see if it's system 1. So both have system 1, yes. So you would hope that because it would appear on a GP system, that the flag would be available because it was on the IT system.
Thank you. Thank you to everybody who's put all the stuff in about Oliver McGowan, and all the information is there for people to look upon. And then I also find it important to let patients know what is available and what reasonable adjustments there are. For some people, if they have never been offered reasonable adjustments, they don't know what to ask for or what they need until you make suggestions of what's available. And then they can usually figure out what their needs are from there, and it can be a really useful conversation to have. So I'm guessing that list could be amended over time of where people find out more about what reasonable adjustments they could have, what they could ask for.
Yeah, and I suppose it's hard because you don't want to just send out the list of what the reasonable adjustment codes, because it's numbers for a GP. It is kind of, it has the relevance isn't there for everybody to see, but it does explain, each code does break down into a lot of different categories of what need is, from communication to access to buildings to gosh, off the top of my head, language, as not being English not being a first language. So there's a lot of there's a lot of breakdown. You're talking a good 90 odd breakdown of reasonable adjustments are there, and I think how we then share what's already recorded and see if any of them are missing of what's needed is something I think will be something that will be reviewed going forward. But I've looked at them as pretty much, I would say that most people's needs would be able to fit into the category, at least to be pointed that out, what the reasonable adjustments needed. And then from there, if there needs to be tweaks from there, that's when people can have those conversations. And there is also usually a box at the bottom just to give a bit more information. I think the difficulty is with information and open boxes is that people don't always read them. And we know that people don't always read records. We know that hospital passports, and I know, Heather, you've done some work for hospital passports for autistic people. It's getting people to make sure they understand and have read all that information, whereas the code is just there as hard hitting here, that you've got to look into this information.
Yeah. So somebody asking, do you have any examples of some reasonable adjustments? So some of those could be things like having the double appointments with a GP, so that you've got longer time to be able to talk and time to process the information when you go in. For some people, it's having the information beforehand. Maybe the appointment letter isn't very easy to read, and it needs to be said in a more easily accessible way. We're doing some work at the moment about doing some videoing of around we're doing some work with diabetes education team and looking at retinal screening and taking a video of what that is, for having a smear test, of what does a smear test mean? What does it look like when you go into the caravan or into the hospital ward? What does the equipment look like? So that people aren't scared of something they've not seen before. Reasonable adjustments are, there's so many. It's making things on a level playing field, so that you have this equal access as somebody without a disability to be able to get the treatment that you need. So that's it.
And I think you've done, Heather, you've done quite a lot of work also with things like recording of buildings, not just with the smear, but also for people to take pictures of where they would be going. We look for quiet rooms, quiet spaces, if people find being in crowds difficult. It's so individualized, and I would say for autistic people it's even more personalized. So the thought that needs to go into it is going to be something that's going to require more support for practitioners, I think, and professionals. I think there's going to be a lot of thought that needs to give into some of those, but it doesn't have to be just the building needs to be accessible. It is going to be much more about the person's needs beyond what we've always seen as reasonable adjustments around the physical environments.
Do people have to have a diagnosis to get the reasonable adjustments to use the flag system?
Yeah, it will be around having a diagnosis of a long-term condition, around a disability. So it will need to be good.
The question is coming from given the wait for assessment.
I know.
Considering like the couple of year wait.
I can go back and check that. I really would. I think that they're really valuable questions. And, I always say to Heather, coming to these kind of forums isn't just about me giving you information. I want to hear what people think too. And if that's a query, I'll go back, especially when people are going through waiting lists around diagnostics and pathways that are still in development, and we're working on collaboratively with systems. So I think that's a valid question, and I'll go find out and I'll get back to Heather.
I was just thinking that if somebody is on the list for assessment, then they're on a record somewhere, aren't they? That it would be easy for them to be added on.
Yeah.
Right. I think there are some new messages on here, but the time is going by. Sorry, I started something off without meaning to. So we'll look at the questions and see what else can be answered, and we'll put them in an email back afterwards, if that's okay with you, Tracy. And
I'm sorry I was a bit ad hoc and jumping on. But thank you.
No, it's fine. No, thank you. So I'm just going to just carry on now with the next example, which is looking at hospital passports. And this is just giving you an example from these three's perspective of where they've actually used them. There is one available on the NHS website that's easy to download and use, but some individual hospitals also have their own. So it's worth looking to see what there is around. So hopefully this now will start.
When I was in hospital, I was very much prepared for going and sent them a hospital passport, which Pat also uses. And that way, and I think actually thinking about it, it would be good for that to be on our GP records as well, because then the GP can have a look. Because I get very tired of explaining the same things over and over again, the same people. And so definitely.
So a hospital passport is basically details about yourself, And so in there, it talks about, so basically who you are and the people around you. And but it also talks about, so the way you communicate when you're in pain, because that can differ from when you're in, are you okay, Nick?
I need, can I just stand
Yeah.
up and walk whilst he talks about hospital passports? Sorry, Pat.
That's okay.
You carry on.
Yeah, so the way you communicate when you're in pain is can be different to when you communicate normally. And but it also talks about your sensory needs. So your sensory needs when you're in pain compared to your sensory needs in everyday life. And if you're going into hospital, what they can do to support you. So it could be the fact of if you have sensitivity to light, they could turn down lights and or put you in a room, that has dim lights. And at the same time, there's things at the back of the book that I think is quite nice that actually tells people about, so things that you like. And so let's say if you have a special interest in a certain type of book, it means that when people come around and speak to you while you're on the ward, they know actually what conversations to have with you. And so you have a familiar conversation, and rather than you thinking of a topic to say and then thinking about a topic to say. And so I found it really handy because it means that when I've gone into an appointment and or I've gone into hospital, I can just pass over the passport, and I don't have to use that energy and of actually saying information that I wouldn't be able to sort of say. And so, for example, my medication, my name, my address, and
So when we were filming that, as you saw, Nick got up and had a walk around. These films have been edited. We did have some big gaps within the filming, and just after she got up and started walking around, we had this break. And just to give you an example of something that can be done, our videographer had very kindly just got engaged a couple of days before we did the filming. And so I just shared that news with them, and we just started talking about something different. And Pat had just got married, and we were talking about his wedding. And what followed was a lot of laughter, which caused, it was a distraction for what had been going on. The laughter actually reduced some of the anxiety, and we were able to carry on filming probably 10 minutes later, with Nick very, very relaxed and able to carry on very well. But it's knowing, and before she actually got up to walk around, there'd been a few gaps then where we were checking to see if she was okay, because we could see that she started to stim quite a bit. And she knows herself what her levels are. And so it was all done with her being comfortable where she was, and then being able to get up. And I was just sat to the side as that was going on, and keeping an eye on things. So anyway, moving on from the hospital passports, as time is disappearing now quite quickly. Within our Hear Me, See Me voice groups, we started to look at a type of hospital passport, because when we looked at some different areas, there weren't some, there were maybe some for people with learning disability, but there wasn't anything that suited somebody who was just autistic and did not have a learning disability. And as you've heard in a couple of these videos, when somebody is really anxious, sometimes they just stop talking. They just do not have the ability to verbalize anything. And so if they can hand information over, it's a lot easier. So we started to look at this type of hospital passport that would work, and this is discussing it backwards and forwards with quite a few people. And this very quickly turned over into looking at the self-advocacy booklet. And instead of it just being a hospital passport, what was wanted was to have lots of pages so that somebody could take out the pages they need for whatever situation they were in. So the start of the booklet was very much like a hospital passport, a lot of information, who was your next of kin, and people who you would want into meetings with you, whether it was a hospital appointment or a doctor's appointment or any other type of meeting, so that there was other people to contact by the professional if needed. So it then went on from having looking at that and looking at sensory needs and things that spark off, that can trigger a need from a sensory perspective, to then looking at, well, what if I needed to call the plumber, or what if I need an electrician, or if I have to ring up about something else. And so there's a lot more topics were created. So if I need to talk to a professional, I need to ring them up, what do I need to prepare before I ring that person? And so I've just given an example here of this was about going to see a professional, whoever that professional is. What do I need to do before going to see it? So they gave quite a lot of examples over the different topics. So this is just an example of this. At the top of the screen there, write a list of questions to ask when I get there. What is the appointment about? Ask what the appointment is about to get that information. Do I need to make a double appointment? Tell the professional how I prefer to communicate with them. And these are examples to get the person thinking about what is it that they need? What are those reasonable adjustments that they need to have in place? And then it's, what does the professional need to do? And telling the professional what I need. So a reasonable adjustment here is send me a map beforehand so I know how to get there. So I know what it looks like from the outside. So the fear of the unknown is not there. Tell me what's going to happen in the meeting. If this was a meeting with a solicitor, really have a good list of what the topics are that you're going to be discussing, what the questions are that are going to be asked, and give clear directions and clear information. So this is just one example. This is half a page within this booklet, and we have got another session coming up where we're going to hopefully finalise it, and then we need to see where it's going to sit, where people can get hold of it and where we can advertise it. But what they wanted was something that was very flexible, that could be used across any situation that they're going to be going into. And it could be that they're going to something on their own. It could be that someone's going with them, but it's still to help them prepare for what they need to do before they're going in. So that is a work in progress. And whenever we do have these voice groups with a group of autistic people, we can go in with one idea and we never come out with the same idea. And it's absolutely fantastic how this work gets done quite quickly, and how the rubbish that sometimes is seen is sort of discarded quite quickly to what is actually really needed. And so it's been really helpful. So we've got 2 more short films to show, and then we will be at the end of this session. So this is one looking at what could be done in waiting room.
I think as well, what would be quite helpful is that thing of actually, when you actually get there, is that whole thing of actually where you're seated. So the thing of actually, do you actually want to be seated in the waiting room? Or the fact that, if the waiting room is actually very sensory, actually, too much sensory input, and actually, is it better that you're actually seated somewhere different? And that's an option for you. So you could be seated out in the corridor rather than actually in the actual main waiting area. And then the doctor could just come out and sort of get you.
Yeah.
And that just makes it a bit more easier.
Yeah, definitely. Or having just seating away from the main group, so it's a bit quieter. Or I'm not so bad now, but when I was younger, I needed to pace. When I went to the doctor's surgery, I couldn't sit, so space to pace. And like you said, to be able to go outside, wait outside, and then get called in or something like that would be really useful. But it doesn't always happen. So, and when you go to different, like my doctor's surgery is not just one building now, it's half a dozen, so I tend to go to different ones, so it's really hard to know how they're going to call you, when they're going, and that's quite panicky. So it changes, but that's never quite clear.
And I get lost really easily. I've got no sense of direction at all. And if I don't have a clear map, or, you know, because I'm stressed anyway,
Yeah.
and that sort of thing helps.
Yeah, definitely.
And then I'm just going to follow straight on to one where they just started talking about a dentist going to the dentist, and just thought this might be a good one just to share with you all today.
We looked up online to find autistic friendly dentists. To me, I think they've been absolutely perfect. And because straight away I sort of like explained my needs, and I had to have a filling done. And whenever I go in, and they sort of like say like what they're going to do, and they sort of say we're going to like drop down the chair now and everything like that. And just before like the filling, they sort of said like when the next appointment is, and they sort of said to me, look, if you need to bring earplugs in, bring earplugs. If you need to bring your teddy bear in, bring your teddy bear in. And if you want music on, bring music. They literally just said all these things. If you need to bring it in, bring it in. And that was the dent. I've never had that experience in a dentist before, and every time I've gone in since, they've just been amazing. And that was, and they actually state on their website, that they're, autistic friendly dentists. And it's just the fact that they made it so sort of the fact that, you didn't feel silly bringing in a teddy bear into an appointment when actually, I think somewhere else, they hadn't even thought about the fact that you could bring that in, but they actually suggested that I could bring that in, and it did help. It calmed me down in the appointment. So I do wish, that actually I felt more comfortable about doing that in other places, because I think, going to other appointments, if that was suggested that, do you want to bring in something, like a teddy bear or something like that?
Yes, because you call your teddy bear an emotional support bear, don't you?
Yeah.
You even have a little sign.
I have a little badge for him.
Yeah.
So we are nearly at the end of time. You have got Annette's email address. If you or the Hear Me See Me, which you sent it out from, if you've got any ideas or any examples of good practice that you would like to share with everybody else, please do let Annette know. Send them in so that we can include them within work that we'll be doing going forward. The next one where we're looking at health inequalities is on the 29th of November. If you've been doing any work around this that you would like to share, please do let us know, because we're always on the lookout for people like Tracy to come and share what is happening where you are. If anyone's got any more questions, but I'll just have a quick look through. Yes, it will be the same time on the 29th of November. But
I
yeah,
know
thank
there
you
was
all
a
for
lot of
being here.
interest in the self-advocacy booklet, Heather, and whether that we can share that once it's finalised.
Yeah, once it's finalised, it'll definitely be getting shared. We just need to find out how to share it. We're probably going to hold it on our website to start off with, but then it's there for people to use. We're just trying to make something that is a useful tool for as many people as possible. So we'll definitely let you know about that. So I will. Someone's just put something on there. I'm going to look through those things. So thank you, Susan, to see what that is. But if anyone's got any questions that they'd still like to ask, then please put on. If anybody is finished, then please feel free to leave. So somebody's here about my son interacts with digital and avoids paper. We are looking at how we could use it, and it's just in its infancy, really, of where we're going with this. Yeah, so thank you, everybody, for being here, and hopefully we will see you on the 29th of November.